My name is Berhane Abera. I work as a speech therapist at Yakati 12 Medical College, Yakati 12 Hospital Medical College in Ethiopia. Speech is very important for children born with cleft palate because when they have a cleft palate, there's an opening on the roof of their mouth, which is their palate. And so when that happens, when they're trying to speak, the air usually escapes through their nose for most of their speech, and therefore their speech is usually distorted. And so after the surgery, especially if they have the surgery after they started speaking, it would become difficult for them to have an intelligible speech, and that's the reason they would require speech therapy even after the repair of the palate. Working in Ethiopia, usually the children with cleft palate have their surgeries late after they've been speaking for a while, age of 4 or 5. In particular, I have worked with a child that's school age. Usually when they go to school, people can't understand them, so they're shy, they don't want to go to school. And their parents are the only one that can somehow manage to understand what they're saying. But after speech therapy, the child is happy to go back to school. They have friends, and they feel better about talking in front of class and things like that. So it's a very rewarding experience. So there's only one center in Ethiopia where children can get this speech therapy services. And seeing the children, the change, seeing the parents' faces, the smile on their faces when their children are able to communicate with others is really a motivation for me to keep going and to provide the service to as many children as I can possibly help.